Good afternoon. My name is Kirsty Wark and welcome wherever you are in the world to the latest edition of the Qatar Foundation's Education City Speakers Series. I am delighted to be your independent moderator for today's event. Today's online event is presented in partnership with WISH, the World Innovation Summit for Health, and will take the form of a panel discussion featuring healthcare experts from around the world as we look ahead to what 2021 may hold in terms of battling and also perhaps banishing the COVID-19 pandemic. The challenges that 2020 brought us still exist, but over recent months they've been tempered by the optimism created by the development and now the rollout, albeit a very uneven one, of vaccines designed to combat the virus that's affected all of our lives in one way or another. And just the fact that these vaccines have been developed in such a short timescale is a triumph of science. But many concerns and uncertainties remain. Across the world, there are inequalities in access to vaccines, both from country to country and within societies. Vaccine hesitancy, with some people as worried about the treatment as about the disease, risks affecting take-up and the prospects of forming widespread immunity against the virus. Disinformation and skepticism about the vaccines continues to spread. And then, of course, there are the new variants of COVID-19 which have emerged, apparently more infectious than the one that started the pandemic, and there are questions over whether the vaccines that have been developed are effective in tackling all these variants. It will be extremely interesting to hear from our panel and indeed from you about this today. Perhaps the only certainty is that the worldwide effort to get on top of the virus is far from over. We're here today to talk about what we might expect to happen this year, whether the development and rollout of vaccines mean life may return to something like pre-pandemic normality, or whether we'll still to face global challenges for some time to come. Because as we know, this is not over until everyone is protected. For those of you joining us for the first time, the Education City Speaker Series is a Qatar Foundation platform that provides people with an opportunity to hear from, learn about, and interact with thought leaders on the biggest topics facing our world, and there is none other that is bigger. Since the pandemic began, it's taken place in virtual form. We had a first online edition last April where we discussed global responses to the pandemic. So it will be fascinating to hear from these same people, some of them, a year on, about where the world stands now. WISH is Qatar Foundation's Global Health Initiative and was launched in 2012 by Her Highness Sheikh Moza bint Nasser, chairperson of Qatar Foundation. Though the summits have all-round activities each year, WISH brings together healthcare leaders, practitioners, and innovators to tackle some of the world's most pressing health challenges and to advance the conversation about the future of healthcare, sharing knowledge and unlocking new insights. But before we welcome our speakers, just to remind you that this edition of the Education Speaker Series is being hosted on Microsoft Teams, where you can have live translation and subtitling in English, Arabic, French, Spanish, and Italian. And you can also watch it on Qatar Foundation's Facebook page, YouTube channel, and Twitter feed. And whichever platform you're watching on, we want to hear from you. Over the next 40 minutes, each of our speakers will be giving their perspectives and having conversations about the COVID-19 vaccines and the positive path ahead for the pandemic. And then we'll be putting some of your questions to them in 20 minutes Q&A session. So please do use the Q&A section of the webinar to post your questions, and I'll try and get through as many of them as possible. Now, we have a number of very distinguished guests today. In a moment, we're going to be joined and welcome back to Education City Speaker Series to Dr. Ahmed Al-Madari, the World Health Organization's Regional Director for the Eastern Mediterranean, representing an area stretching from Pakistan and Afghanistan to Morocco. He'll be joining us very soon from Cairo. Another returning speaker is Dr. Matshidiso Moeti, the World Health Organization's Regional Director for Africa, the first woman to hold that post, which sees her being responsible for coordinating the healthcare efforts across 47 countries. Welcome, Dr. Moeti.
Thank you very much, Kirsty, and greetings to my fellow panelists and those who have joined us. I look forward very much to our conversation today.
Now, thank you from Qatar. I'm pleased to welcome Dr. Abdul Latif Mohammed Al-Khal, Chairman of the country's National Pandemic Preparedness Committee and Deputy Chief Medical Officer at the Hamad Medical Corporation, Qatar's main health provider. We're very glad you can join us. You must be very busy, Dr. Khal.
Thank you, Christy, and hello to everyone. And I would like to thank Wish for inviting me to this distinguished panel.
Now joining us from South Korea is another friend of the Education City Speaker Series, Dr. Jerome Kim of the International Vaccine Institute and a world-renowned expert in vaccine research and development. Dr. Kim, thank you for being with us.
Thank you, Kirsty, and hello to everybody, and hello to my fellow panelists.
And finally, we're delighted to have with us Professor Nahiko Shindo, Senior Advisor of the World Health Organization's Health Emergencies Program. Professor Shindo, welcome. Thank you very much for joining us.
Thank you, Kirsty, and hello to all my fellow panelists. Extremely feel honored to be part of this discussion.
Well, we're delighted to have you. Now let's just kick off straight away, Dr. Moeti, with an unfortunate byproduct of the race to develop the COVID-19 vaccine, and that has been vaccine nationalism. You know, countries are competing for limited resources at the moment, and the broader question of distribution and vaccine distribution itself, how could that be made fairer? Also, what do vaccine-rich countries have a responsibility for? Do they have a responsibility to share their vaccines with countries that have fewer supplies? Dr. Moeti.
Yes, thank you very much, Kirsty. Great question. And again, I'd like to thank the Qatar Foundation for having invited me back and for promoting important discussions like this one. Well, indeed, it is important that countries, whatever is their economic situation in this context of a global pandemic, share the opportunities and also share the challenges. You know, the COVID-19 vaccines are life-saving tools in our battle against this virus, coupled, we must remember, with other strong and sustained public health measures. And they are our best chance to bring the pandemic under control. In Africa, it's been disappointing and even painful to see the inequities in vaccine distribution around the world play out. We've seen 10 wealthy countries account for 3/4 of the 194 million vaccine doses administered worldwide, whereas around 45 African countries have yet to deliver a single dose. I'm very happy to say, though, that this morning at 8 o'clock, 600,000 doses of the AstraZeneca vaccine were delivered in Ghana. So that is the first substantive quantity of vaccine to be delivered in the African region. So ensuring that low and lower middle income countries are not left behind in vaccine rollout, we believe, is a moral imperative. Our Director General has said that very clearly. It's also a public health necessity. With a powerful economic rationale, we know what's happened in economies worldwide, and particularly in African countries. Research shows that ensuring equitable access will save up to $500 billion globally and afford protection to all economies. So an example of making vaccine distribution fairer, in November 2020, WHO, together with Gavi, the Vaccine Alliance, and the Coalition for Epidemic Preparedness Innovation called CEPI, launched the COVAX facility, which is a multi-sectoral coalition bringing together governments at all income levels, global health organizations, pharmaceutical companies, and researchers contributing as they can financially, their managerial capacities, with a core principle of advancing at the same rate in acquiring vaccine and in covering their populations in each country. In short, sharing vaccines, sharing the challenges that the world is facing in having access to vaccines. So we're very glad to see this translate in Africa through this first delivery to Ghana. And believe me, there have been tremendous challenges in terms of the manufacturing capacity of the pharmaceutical companies that have developed these vaccines. And in some cases, agreements and disappointments by countries based on the agreements that they've reached as the companies have confronted their capacity challenges. COVAX targeted having 90 million doses of the Oxford AstraZeneca vaccine delivered to 43 countries in WHO Africa region. 36 of which will receive these vaccines at no cost, because these are low-income countries that normally get funded free by Gavi. And the intention is to have, by the end of this year, 20% of Africans who are most at risk covered with a vaccine. So what would we like other countries to do? So to make this distribution fairer, sustained support from wealthy countries to the COVAX facility is vital. So countries with excess vaccine supplies should also consider donating vaccines, and there are conversations happening on this to high-risk priority groups in other countries, so that we vaccinate health workers more or less at the same time in all countries before we reach the lower risk groups. Manufacturers, of course, should commit to sharing data, including on safety and efficacy, so that WHO's process for emergency use listing can go very quickly for those countries that are very much dependent on this. The pandemic has also reaffirmed the need for strong pharmaceutical manufacturing companies in African countries. We're learning that lesson, but it also requires or encourages commitment to sharing intellectual property, so that this production in a number of contexts can take place more quickly. And then we expect countries that have the production capacity not to prohibit the exportation of the vaccines that are produced by pharmaceutical companies in their territory. So this is what we're expecting. So contribution in terms of financing, that's happened. Contribution in terms of sharing the pace of acquiring vaccines, not cornering the market with the resources available and the volumes that can be procured, allowing the exportation when countries are able to do so, and also sharing some of the doses that they have acquired, so that it is moving at the same time for all countries, because as long as some countries remain vulnerable, we are, the whole world, vulnerable.
Dr. Moeti, before I leave you, I just want to check if I picked you up correctly when you said that you hope that 20% across all Africa will be vaccinated by the end of the year. Just 20%?
Well, this is the reality that is being faced by the COVAX platform initially. So I should be more accurate and say the initial ambition is to reach at least 20% of African populations, so of COVAX participants' populations, knowing that other activities are being undertaken by the countries themselves to acquire vaccine in addition. For example, the African Union has taken very strong action collectively under the leadership of President Ramaphosa of South Africa, who was chairing the AU until the beginning of this year, to pool together their resources to work with Afreximbank, with the World Bank, and be procuring vaccines as well, hoping to cover up to 60% of populations.
Super.
But at least, so COVAX at least was targeting an initial 20%. We will see what resources become available if the situation of vaccine availability in the global market becomes better. And of course, our ultimate ambition is to make sure that African countries reach that level of coverage that will transform the situation as far as risk from the pandemic is concerned.
Dr. Al-Hawal, if I could turn to you next for perspective from Qatar. You got the vaccine. Having the vaccine developed is one thing, but getting out to significant numbers of the population is quite another matter. And so every country, I think, has challenges about this, about take-up. And I wonder how you have combated this and what your strategies are.
So thank you for that question. Here in Qatar, we worked very on during the pandemic to secure the vaccine. So we approached companies that were more advanced in their clinical trials. We also participated, and we are a member of the COVAX facility, where we will get a percentage of our vaccines from. One of the challenges we faced in rolling out our national vaccination program had to do with the global shortage of the vaccine and limited initial supplies. So this was, of course, the case for most of the rest of the world. And current production, global production, is just a tiny fraction of what's really needed. One of the, of course, big questions that we yet have to answer is, well, whether we will need to do this on an annual basis, whether we will need to vaccinate people every year, just like the case with the flu. If this is the case, then we have to work very early on planning for our future supplies of the vaccine. So to address this challenge, we decided to procure vaccine from several manufacturers and introduce different types of the vaccines into our national program, in addition to prioritizing the vaccine to those at highest risk initially. Another challenge has been ramping up the campaign to a very highly unprecedented level, where we aim to cover up to 90% of the eligible population before the end of the year. This means we have to vaccinate more than 100,000 people a week. So this requires lots of resources, and this is happening at a time when we need to dedicate resources to fight the pandemic. We still need to do public health work, screen people, isolate them, to try to combat the resurgence of the vaccine. To address this issue, we leverage the existing primary healthcare system with its 27 health centers scattered throughout the country, where they provide the vaccine 7 days a week from 7 in the morning until 11 at night. In addition, we recently opened a vaccination center at the Qatar National Convention Center, which can deliver 8,000 doses a day to 8,000 people. So this boosted our ability. We also trained nurses at different ministries and other governmental entities on vaccination, like Ministry of Defense, Ministry of Interior, Oil and Gas, Qatar Airways. And now they are vaccinating their frontline workers at their own facilities. So this is really helping. We also today, I'm glad to say that we started an initiative where we go to the elderly who cannot make it to the health centers, to their homes, and administer the vaccines to them and their close family members. So this hopefully will help change the mind of many of the elderly people and their family members about the vaccine. One of the big challenges we faced initially, we still face, but not to the same extent, is the widespread disinformation about the vaccine safety that circulated widely through the social media. This made a significant proportion of the population reluctant about the vaccine. And unfortunately, this hesitancy led to many hospital admissions and intensive care admissions in people who were otherwise, could have easily gotten the vaccine about 4 or 6 weeks ago. To address this challenge, we established a group whose job is to disseminate the evidence-based information and fight the misinformation and use community figures to try to get the message across. So these were the main challenges, and there are, I think, lessons that we learned. Maybe other countries can learn from what we did, and maybe I can share some of those. One, to start with, every country really have to have their own national strategic plan on to vaccinate against COVID, and this plan should be based more or less on WHO guidance. The plan should be adhered to as much as possible. There is always a lot of pressure to try to dissuade the national health authorities to come out from the plan that they have, where many entities would like to get the vaccine before those who are really eligible for the vaccine. So there should be resistance to this. The other thing is the national plan should be coupled with a very strong advocacy campaign to change the misinformation that spread in our region. I also suggest that countries try and leverage their existing public and private healthcare infrastructures in delivering the vaccine. This way they can avoid duplication of resources, and also if this happens to become annual event that every year people have to be vaccinated, then it would be already integrated in their everyday routine care. The last point is countries perhaps should think of incentives for those who get the vaccine. For example, if you get the vaccine, you will not be quarantined if you travel and return, or if you are exposed to someone who is positive. this may encourage more and more people to get the vaccine. So I'll stop at this and back to you, Christy.
It's so interesting. It's so interesting. I think across the world, people are thinking of ingenious places to give the vaccine, which encourages people to go. You know, it could be at swimming pools or airport terminals or lots of different places that people understand and will go to. Dr. Kim, obviously the first vaccine candidates were approved very, very quickly. And of course, people thought that was amazing. And then it led to, you know, concerns about this vaccine against that vaccine and so forth. Just confirm that it is safe to have moved that quickly before I ask you about vaccine hesitancy being addressed. I mean, tell me about what you think of the speed that the vaccines were approved. If I just pop you off, if I could just pop off mute. We don't want to miss a word.
Yes, so thank you. I think when you actually look at the data, when you look at the 200,000 people who participated in clinical trials around the world, we did what we normally do for clinical trials. We followed the same sets of rules for licensure and approval of those of the clinical trial data. In many of the trials, half the people got vaccine, half got placebo, 15,000 people in each group. Followed for a certain period of time according to all the international guidelines for following people in clinical trials. So those data on efficacy and safety were collected in the exact same way that we do for all the other vaccines. The big difference is that we were allowed to look at the data a bit earlier than normal. And the reason was that we thought, A, that there were enough infections going on so that we might have early proof that the vaccine was working, and B, the pressures imposed by the pandemic were such that countries around the world were looking for vaccines as a solution for other things that had not been so successful. And you know, I think that the final aspect of this is, and it's around the emergence of mutants. The combination of masks, distancing, and vaccination is going to be one of the best ways not only to control the epidemics that we have, but to reduce the generation of mutants, which are going to eventually undermine the effectiveness of vaccines. So there's a good reason and a lot of reason for people to understand we tested these vaccines the way we test all vaccines. We were allowed to look a little bit earlier, but the data are very definitive. And the safety data now, not only from the clinical trials involving 200,000 people, but from almost 200 million injections given around the world, we are collecting safety information, continuing to collect safety information. The vaccines have a remarkable safety record.
That's extraordinary, Dr. Kim, what you were saying, though, because people perhaps don't equate suppressing new mutants by getting the vaccine, because the quicker you get the vaccine, the quicker we're going to get on top of new mutants. That in itself is a terrific incentive. So how do you get that? Is it about messaging, this vaccine hesitancy that exists? I mean, how do you get it across to people?
And so the WHO actually has some really interesting guidance on this. And it's a publication that they put out, I think, in November. And the first thing was, you know, lead with the science, because that is the best foundation that we have to be able to assure ourselves and to convince others that what we have are safe and effective vaccines. So lead with the science. The second part is we need to enable vaccination. We can't make it so complicated or difficult that it's going to be hard for a person to get a vaccine. And my colleague and friend, Dr. Stanley Plotkin, who's over 80, who authored the textbook on vaccinology, who helped to develop 8 vaccines while he was at Sanofi, who's a professor of pediatrics, couldn't find a place to get vaccinated in the United States. That's not enabling vaccination. So enable vaccination. Provide positive socialization around vaccination. Make it something that makes people proud to be vaccinated, that gives them a lot of positive reinforcement about participating in this global or nationwide effort to control a pandemic that has really knocked us onto our back foot. And then finally, the governments need to figure out how to motivate people. And maybe it's giving them a reward. But we have to find ways to motivate people to do this. And is it influencers? Is it you know, getting rock stars to do it? Is it politicians or movie stars?
Well, yeah, absolutely, Dr. Kim, and I think this whole idea as well, though, of understanding that the vaccine is available. I mean, is there actually, for how long do you think will there be a vaccine shortage, or do you think production is getting ramped up every single day, Dr. Kim? Well, I'll come on now.
Vaccine is being ramped up.
Yeah, vaccine is.
So yes, I'm sorry. So we are increasing vaccine production every day, and as more companies are approved, both by national regulatory authorities and by the WHO, you will see significant increases in production. We're still in the early days, though, and in the early days of scale up of manufacturing, there are going to be glitches. There are going to be things that companies need to do in order to significantly increase production, as happened with Pfizer. By the middle of the year to the end of the year, there may be a lot more vaccine. I mean, if we look at what the companies have promised, it's substantial. The problem is right now. And right now, for instance, COVAX is a bit stuck until, Novavax and Johnson & Johnson come online, or the Chinese or Russian manufacturers are brought in to the COVAX mechanism, because right now, the only two things that they can use are Pfizer, which doesn't have a lot of doses, but also has logistical issues around cold chain, and the AstraZeneca vaccine. Yeah. So again, we have to, move vaccines into the COVAX process to get them out and distributed worldwide.
And Professor Shindo, if I can just come on to you, there's a challenge of getting enough vaccine, there's a challenge of getting the vaccine out there, there's a challenge of vaccine hesitancy, but the challenge of vaccine is also around fake news and internet theories surrounding the virus, including anti-vaxxer campaigns. How much of a threat is this to global public health?
Well, thank you for that question. And I listened to Dr. Al-Khal and Dr. Kim, and they both pointed out the importance of communication and also to cultivate a positive attitude. We don't call it anymore vaccine hesitancy, but we try to focus on vaccine acceptance as a positive attitude. So one of my roles here today is to talk about infodemic. So our Director General, much earlier on, from the outset of pandemic, he said, we are not just fighting an epidemic, we're fighting an infodemic. As you can imagine, in the 21st century, people have lots of digital sources to get information from. So there's abundance of information. We call it tsunami of information, including good ones, bad ones, misinformation, disinformation, fake information. We all have to choose what we have to learn. And this is really a difficult thing. We can give you some really bad example, like the people were misinformed that if they ingest disinfectant, they will kill the bug. No, it's not true. As a consequence, approximately 800 people have died, and nearly 6,000 people have been hospitalized. So this is the consequence of bad information, but people received this quite seriously and actually committed this very unfortunate action. So this is what we are fighting for. So WHO set up a mechanism to collect vast information, cutting through all major social media and try to manage the infodemic. First of all, as Dr. Kim says, that we have to start from science, but not only science, but WHO published much earlier ethics framework that we have to stand on. This really shapes our recommendation where to start vaccination, where we can put more emphasis on vaccination, because we cannot regard vaccine as just an ace card in your hands. No. It's just one of the cards. You have to have a very good hands, right? So we have been advising about public and social measures and a correct information gathering, and everyone to be responsible, because everyone has responsibility and role to play in this pandemic. It's not just the top-down message, or we really need a bottom-up effort to control this disease, right? So the right understanding of vaccine is so important. So we listen to people. by social network analysis. What are the key attitude, key influencers, and how the misinformation travels, because of what? So we have to utilize our social science and behavioral science to understand that. And we quantify information through social listening. We listen to people by using keywords. So these are the efforts we are undertaking under the name of infodemic management to make sure that vaccine can play its role.
Thank you very much indeed. We're delighted that Dr. Mandari is joining us from Cairo now. Hello, we spoke back in April at the beginning of all this. The World Health Organization that has now rolled out about 6 million vaccines across the Middle East. But the healthcare systems of the countries involved vary wildly in terms of resilience and also complexity. How can the disparities in the effectiveness of the rollout be ironed out?
Thank you, Kirsty, and good afternoon, colleagues. I'm sorry for the delay because I had some technical problem. And in fact, answering your important question, the COVID-19 vaccine has been distributed in EMR, in EMRO, similar to some other regions, based on bilateral sort of agreements between these countries and the producing industries. However, for the coming few days, inshallah, we are going to have vaccines deployed to those countries which have not yet started the vaccination campaign through the COVAX facility. And we have been working, Dr. Rashidi and Director General, Dr. Tedros, and RDs and the team there in headquarters to make sure that these countries will receive. And I fully agree with you that, as a WHO, we are aware about, how many healthcare systems here in the region in Ebro, as you know, 2/3 of our countries are either under acute or protracted emergencies and conflicts and instabilities, that their systems are not really sufficiently strong and ready to cope with the pandemic at the beginning, but also with the requirement of deploying the vaccine and making sure that no one is left behind. So WHO at its 3 levels, country, regional, and headquarter levels, colleagues have been working day and night, in fact, to make sure that these countries are really ready from the beginning of providing updates on the vaccine development and supporting countries in making, policy decisions and identifying, prioritizing, defining the strategies for vaccination of different groups, supporting countries, in areas of vaccine regulation through facilitating and obtaining required information from the manufacturers and producers and WHO, beside providing technical input for provision of for example, emergency use authorization by the country, how to make it, providing opportunity to chairs of the national technical advisory groups for immunization to participate in the strategic advisory group at a global level and be updated.
But also in terms of sorry to interrupt, Dr. Mandari, but just in terms of different resilience in different areas, are you training vaccinators locally to go out and do work in their own community?
Exactly. This is what we are also doing, providing tools and guidelines for developing the national deployment when it comes into the storage of these vaccines, and then providing these vaccines to those who are in need of it, providing critical input to such plans, and also giving, as you say, the technical assistance to those frontliners who will be going to the communities and giving the vaccination and making sure that whatever resources they have are well utilized to serve those in need of the vaccination, especially the target group, those among the 20% of the group.
I'm amazed by the amount of people volunteering to be trained as vaccinators unpaid. I think it's tremendous feeling of goodwill when people do that. Now we've got questions coming in now. Dr. Moeti, I've got a first question for you. What are your thoughts on the possibility of countries or organizations forcing citizens to be vaccinated? Is that a necessary move that you would support in order to improve the situation, move more quickly?
Yes, thank you for that question. Well, I have to say that at the moment, the challenge African countries are facing is not so much the vaccine moving, it's the vaccine being available at all. As I said, we've had some vaccine arrive in Ghana, we're celebrating, and we are hoping this will accelerate. And I think just following up on what I said, there is some level of vaccine hesitancy in countries, but you know, WHO does not recommend, first of all, obligatory vaccination of people. And what we think will work better is for people to understand why this is important for themselves, for their families, for their loved ones, their communities, their countries, their economies, and their livelihoods, and accept to be part of this movement. So we would rather go the route of encouraging and informing people and spreading information about why it's important to be vaccinated, to protect yourselves, your families, and so on. Yeah.
And sticking with you, Dr. Moeti, I mean, we were just talking about the way that countries develop ingenious arrangements for getting the vaccine out. There are ingenious developments in Africa about how to get the vaccine out to people and to get it to the priority groups.
Yes, so work has already started, as was said by our colleague, Dr. Alkal. It's important for each country to develop its own plan. So virtually all our countries, apart from a few, have now a strategic plan, and they are now going to start doing what we call micro-planning. And within that, they've defined what they're going to do first, which groups are being targeted first, and are now going to get down to the details of how they're going to reach those people. Information is already going out in the social media, through radio, other routes of information to indicate who are the groups that are being targeted. And then the idea is to bring the vaccine to as close as possible to where people are. At the moment, most of the people, if you like, the hotspots in African countries are mainly in urban areas. So that will clearly have to be the first places to start. And then we need to look at healthcare workers in other areas as well, as we protect that group, because people do move around. So this is very much being planned in terms of the operations and the communication with the population for them to play their part.
Now, we have got, these are questions coming in from the audience, and I have now a question for you, Dr. Alkal, and it's a question from Nawaf Zainal on Microsoft Teams. For people suffering from cancer or with weakened immune systems, would taking the vaccine still be advised? And what about people with diabetes or high blood pressure? Dr. Kal.
Yeah, I would like to thank the audience for the question. This is an important question that comes again and again, and whether we should delay, defer, or give the vaccine. The general consensus is not to delay the vaccine as much as possible and just to go ahead and give it. Definitely people with cancer and other serious chronic conditions like heart disease and kidney failure are at a significantly increased risk for severe infection that leads to hospitalization and even death. In general, you know, if the vaccine is available, just go ahead and take it. The response may not be as good as in younger, healthy people, but at least it may give some protection that may decrease the need for hospitalization and death. And this applies to all of the risk groups that came in the question.
Thank you very much for that. Now, one audience question for you, Dr. Al-Madhari, and that is, what is really the goal of the vaccine against COVID-19? Is it to end this pandemic, to lessen the symptoms of recurrent infection of COVID-19, or to eradicate deaths from the virus? What should be the priority?
Thank you, Christian. This is also another good and strong question. In fact, you know, if I may just answer it, this pandemic is new to us. We have never experienced such pandemic for the last 100 years. And it really shook the whole world and every system, every corner in each country. Now, vaccine is, yes, a tool to help us protect ourselves from the vaccine. First of all, you know, in getting the infection, and second, you know, in making these infections, if we got it, less severe in terms of you know, the severity of the disease itself, and thus ultimately saving lives, especially those groups who are vulnerable, like as Dr. Al-Khal mentioned, those with NCDs, those with immunity problems, those who are at the front line as risk exposed group. But at the same time, I must say, this vaccine is one of the tools, to help us protect ourselves and make sure that we save lives out of this pandemic, adhering to the public health measures, well-known measures that have been shared and communicated all the time since the beginning of the pandemic. Like, for example, keeping the hygiene, social distancing or physical distancing, avoiding mass gatherings, wearing the mask, protocols of coughing and sneezing, as well as strengthening the public health measures for healthcare systems. So these are the tools that will complement the vaccine deployment.
And here's another question, this one to you, Dr. Kim, and actually it follows on from that as well. But for how long can we expect vaccines such as the one from Pfizer to offer protection against COVID-19? If you could pop yourself on. There you go.
Sorry, that's a great question, and I wish I had a definitive answer. What we do know is that, and now at least for the Moderna vaccine, we have 3 and 4 month follow-up. It looks like the levels of what we call the protective proteins or antibodies that inactivate the virus are still present at very high levels, at least for the Moderna vaccine. So that's one thing. That would offer some hope that these vaccines are going to behave like standard vaccines. The problem is that we don't know what it will be at 6 months or 12 months. I think one of the very interesting things is that we now have increasing evidence that a single dose of vaccine works. And the single dose of vaccine works before we see these inactivating proteins, before we see the neutralizing antibodies appear. So there are other things that the vaccines are doing that are inducing protection against the virus, and defining those is going to be very important because they could be very critical in sustaining the response beyond the period of time where we are right now.
So I want to come to Professor Shindo now with a question here that I have. Then is, with the vaccines being rolled out and with just exactly what Dr. Kim has said, do you feel there is a risk of countries that currently have lockdowns or restrictions in place lifting them too early? I mean, can we expect countries to keep absorbing all the economic and social pain as the vaccine reaches people?
As I said, vaccine is not a single cause you have. Yeah. Like our regional director from AMRO rightly said, that we have to use very good cards in your hand. You have to use everything. And this is the key to make the ACE card more impactful. And very unfortunate is that people just rely on vaccines. It's like a panacea. It's not the case, I'm sorry. So you really have to inform and communicate with people the importance of it. And one struggle that you said, anti-vax sentiment, and then we are trying to flip it over to the positive attitude of vaccine acceptance. But the obstacle is still people's worry about safety. Dr. Kim assured us that tens of thousands of people and millions of people are now being vaccinated. We have very weak signal anything bad happens, but we have to go one step further to be more humble and communicate, and then we have to be transparent about single small things, to communicate single small things, meaning that the country have to implement a good monitoring system so that we can collect the information and provide people with very detailed, strong scientific data about adverse effects. Because one of the anti-vax sentiment were strongly expressed by healthcare workers, because they know the most about the risk and safety issues about vaccine. So in order to get them engaged, we have to provide them very good, transparent information.
This information issue is really, really important, because Dr. Al-Khal, I've got a question for you. which has come in from MS Teams. And this is an interesting one that somebody thinks this. Given that quarantine exemption is in Qatar is for a duration of 3 months following the second dose, does this mean that the vaccine is only effective for 3 months and that it's not effective after this period of time? The person says, why such a short period? Can you rebut that, please?
Yes, sure. That's a very good question. We base that decision on the available data of the duration of the protective level of antibodies in the blood following the second dose. But there is more emerging information that the duration is probably longer, and we hope that it will be at least a year or even more. So what we are going to do is that this was a starting point, and we are reviewing the literature and the data as it emerges regularly, even on daily and weekly basis, and we are ready to extend this to 6 months validity as soon as we think there is enough information to do that. And then before it's the end of 6 months, we will do the same again, and we'll probably extend the validity. So this is only just a starting point. It helps encourage people to take the vaccine because they see some other benefits from getting the vaccine, and not only just protection from the infection, but also some privileges like waiving from quarantine.
I have a question now, Dr. Moeti, you'd like to come in, so please do come in just now.
Thanks very much. No, I just wanted to follow up on that response, just to say in general, I think we're learning, because this is such a new virus and a new situation, that countries, governments and others are having to be quite nimble and flexible in their responses and to adjust them as more and more information emerges. And in a way, referring back to your question about lockdowns, lockdowns were a very blunt instrument at a time when we were learning about the vaccine, about the virus, and countries needed to put in place these very extreme measures. They're not something that you need to do in the whole country and in such a comprehensive way. They need to be combined with the public health measures. And frankly, now we're having to counteract the fatigue at the level of communities and populations to keep this up. And all of this can keep being adjusted. I think that's a very important message, that we have a combination of tools and means that need to be adjusted based on data in countries and as locally as possible, so that we overall allow normal life to get re-established. The vaccine holds out that hope very strongly, but we shouldn't rely on it to just solve everything in a few months.
Now, Dr. Moeti, I want to stick with you because there's a question has come in from Gauri on MS Teams. I'm wondering what the guidance is for pregnant women. There seems to be some concern about the long-term effects of the vaccine on soon-to-be-born children, but being 18 weeks pregnant myself, I'm wondering if the effects of COVID will be much worse.
I think the effect on pregnant women is something that we are not certain about yet. I understand that there are some particular studies going on to look at the situation with pregnant women. For the moment, WHO is not recommending that pregnant women not take the vaccine. So I think it is being recommended for all people, particularly those with particular comorbidities, including pregnant women, particularly to have these comorbidities.
Thank you very much. I have a question now for Dr. Kim from MS Teams. How effective are the Moderna and Pfizer vaccines in the fight against the new mutant variants of the virus? And how long is a vaccine effective? You sort of touched on this anyway, before we need to be vaccinated again. Dr. Kim, you're determined not to be heard.
I think you got the answer to the second part of that question from Dr. Al-Khal.
You did, yeah.
As we get more information, the time will be extended from 3 months to 6 months, and I think that's the best explanation for that. How effective are the vaccines against the mutant viruses? And so we have two types of evidence. We have test tube evidence, and we have actual clinical trial data. So what does the test tube evidence tells us? That most of these vaccines, including the Sinopharm vaccine from China, have activity. They continue to neutralize the mutant viruses in a test tube. So that neutralize means the vaccine induces protective responses, and some of these infection-fighting proteins or antibodies bind to and inactivate the virus. And it binds to and inactivates mutant viruses also. Now, Test tube data and human clinical trial data are two different things. Right now, we have important data from Novavax and Johnson & Johnson that their vaccines appear to work not only against the variant found in the UK, but against the variant found in South Africa. Very important information. Importantly, the AstraZeneca vaccine continues to protect people against severe consequences of the mutant viruses. So again, this gets to what Dr. Almandari was saying. You know, one of the things that we want vaccines to do is to decrease the number of people in the hospital who get moderate to severe symptoms, who are hospitalized, who are put on ventilators, and who die. And doing that is actually a very important thing. So these vaccines do have significant evidence that they continue to work against the current set of mutants. The faster we get control over the outbreaks, the less likely that new mutants will arise, hopefully.
Thank you very much. Professor Shindo, you wanted to come in there.
Yes, so about mutants, this really poses a communication challenge to us. But I would like to say two very important things about variants. So the variant emerges when the outbreak is not under control. Uncontrolled community level transmission really gives the virus to mutate and create mutants. So in order to protect the vaccines we have, we really have to suppress the transmission in the community. That's one of the other reasons that we have to be careful and continue these public public health and social measures in place. And the second point is we have to roll vaccination as fast as possible, because if you delay the vaccination, you will give opportunity to the virus to mutate. Thank you.
Dr. Almandari, I want to ask you a question about this whole business of variants. And do we simply assume that COVID-19 will become like flu, is a lifetime threat, and almost just becomes a fact of life? And in a sense, the current cycle of lockdowns, easing restrictions, locking down again, ultimately, do you think people, like flu in a way, are going to have to, or going to be prepared to accept COVID-19 in their lives?
Yeah, thank you, Kirsty, for this question also. And in fact, just I'd like to say, and I'm glad that we have Professor Kim and Professor Shindo with us, who are real technical, clinical, experts. All viruses, it is a fact, all viruses, including COVID-19 virus, change over time. This is one of the natures of these viruses. And so far, we have seen hundreds of variations of the virus that have been identified worldwide. And most of these changes we have been witnessing have little to no impact when it comes into the virus probabilities. However, has also been shared by centers around the globe that it may affect the transmission, or maybe sometimes in some studies the severity of the disease. So far, there is no single scenario that we can say the virus will end from the world. One of the proposed scenario that the virus will become weak, or it will be like a flu-like seasonal influenza-like virus. And another scenario, that the disease will be ended either with no or just sporadic cases, as Prof. Shindi has mentioned. But so far, we have to make sure that whatever proven public health measures implemented, we continue implementing it, plus making sure that the vaccination will reach everyone in each country, regardless of its wealth, as soon as possible. Now, when it comes into applying these public health measures, the known one, it should be balanced against other risk factors. Like, for example, when we talk about lockdowns and curfews, it has to be balanced with other social, economic, and cultural risks and factors. But generally speaking, countries have learned a lot from this pandemic.
A final audience question now, and that's for Dr. Akhal, and it's from Emin Rawan on YouTube. Quick one for you, Dr. Alkal. When will we get rid of masks? When will we get back to normal?
I don't think it's in the foreseeable future. It looks like there will be a need to continue to use masks and certain degree of precautions, even if a significant percentage of the population get vaccinated. Unfortunately, it's more and more looks like this will be part of the new normal.
Yeah.
And we have to contend with it. I hope that one day we will get rid of it, but I don't see it happening in the foreseeable future.
Well, thank you very much to the audience for all your questions. We had so many questions coming in. I wish we'd managed to get to more. But before we finish today, I'd like each speaker to give some short final remarks as to how we should behave in these critical months in order to join the global efforts to actually beat this pandemic. So I'm actually going to go back to Dr. Almadari for your thoughts on this first, just briefly.
Thank you, Christy. Thank you. Just my message, to the world leaders. They need to maintain strong political, social, and economic solidarities to stay, to scale up the global response and minimize the impact of the pandemic. We have seen it in front of our eyes in all countries, regardless of their wealth. So this is my request and my call to the leaders, especially nowadays. When we talk about vaccinations, rich countries have the full capability of making sure that their citizens will be vaccinated, but we should not let citizens in other low-resource countries alone, and no one is safe until everyone is safe. So that is my message. Thank you, Kirsty.
Thank you very much. No one's safe till everybody is safe. Final word from you, Dr. Moeti.
Yes, thank you. I mean, just building on what was just said by Dr. Alhal and my friend Dr. Ahmed, two things. If we're going to go back to normal and we'll be able to get rid of the masks, then we need to make sure that everybody is vaccinated. So I'm asking all of us to add our voice. If you're fortunate enough to be in a country which is wealthy and you can be vaccinated sooner than others, add your voice and advocate for your government to take care of this so that your life can go back to normal finally, and you don't have to be carrying a COVID passport or blocking other people from visiting your country because they don't have a COVID passport. So that's first, and then in the meantime, let's do our best. Let's all wear our masks, put up with the disinfectants until such time as we reach that point. And thank you, it's been a great conversation.
Thank you. Now can I speak to you now about this, Dr. Alhal, your final words.
Thank you, Christy. I believe that in order for us to control the epidemic and start to go back gradually towards normal life, every member of the community in every country should feel that he or she has an active role to play in fighting the pandemic, and that each person has individual responsibility that they must fulfill by following restrictions and basic preventive measures. In addition, every member of the community should not hesitate and get the vaccine when their turn comes, and should continue to implement the preventive measures even after getting the vaccine. Thank you. Back to you.
Thank you so much. Dr. Kim.
And I think I'm off mute. Yes. So I think everyone has covered some of the key issues. So I'm going to go to the science part. I think there's still a lot of questions that we really need to answer. What is the correct dose? What is the correct spacing of doses? Can we have the dose and double the amount of vaccine available? Do we know that the second wave of vaccines can be tested as quickly and as easily? Because these vaccines may actually make a huge difference. We don't know. Do we understand how the vaccines prevent infection or transmission? And get to the real question around vaccine effectiveness. Is this going to have the impact that we hope? Are we going to be able to establish herd immunity? A final part of the science is actually a very critical part, and that is we need an international network of surveillance and sequencing of viruses from all over the world, so that in real time, organizations like the WHO and others are going to be able to identify variants which pose a threat to the success of vaccines and vaccination. And finally, again, I think we're all in this together. We have to work hard together to vaccinate and to wear masks and distance until such time as the pandemic is under substantial control.
Thank you so much. And the final word goes to you, Professor Shindo.
Thank you very much. So I'd like to remind all of you that each one of us have a role to play. So be kind, be smart, be responsible, and let us have our future back in our hands. Thank you.
Thank you very much indeed. Well, that concludes this online edition of the Education City Speaker Series today, presented by the Qatar Foundation in partnership with WISH. I hope you'll agree we've had some great, fascinating insights into development and the rollout of COVID-19 for some very eminent people, and how the world is responding to them. We've discussed both the concerns and the optimism that surrounds the future of this pandemic and our global efforts to combat it. It only remains for me to thank all our speakers today for this contribution to this discussion, particularly this time they're all incredibly busy people. To thank you all for tuning in and for being part of this event, and also for contributing your questions. And if this has left you wanting to find out more about Education City Speaker Series, the World Innovation Summit for Health, the Qatar and Qatar Foundation as a whole, please visit www.qf.org.qa. In the meantime, on behalf of us all, a very good afternoon, good evening, good morning to all of you, and stay very safe.